to see so many familiar faces here. We have a little chat bubble that you should be able to see, and if you scroll to the bottom, or it may be on the top, depending on what the formation is of your computer or smartphone. If you want to say something and we're not seeing you wave, then type in the chat bubble, and Marissa and I will recognize you. Then you can unmute your microphone, or we can unmute you if need be, and you can let us know what you want to say. I want this to be more of a conversation than just a presentation, although I do have some things to present. I know many of you are working on ways to be able to help out the community, and that's why I wanted to go ahead and have this town hall, even though we aren't able to do the presentations we'd hoped to do with the disaster response team and with alert neighbors. We'll save that for another time, and be able to talk just a little bit more about what is going on in the community right now, and talk about other ways that we can help. And yes, I'm seeing Roger, Joanne, and Marissa and others commenting in the chat room. That looks great. If you haven't muted your microphone, you might go ahead and do so now. Marissa, are you able to bring up the slides?
Yes.
I'm going to have Marissa go ahead and bring up some slides before we have Q&A, and before we get to the part where I will open it up for you all to tell us about what you're doing in your neighborhoods, or what needs you see. There are some resources that I wanted to make sure everyone is aware of. So while let me tell you a little bit about what I have been doing. I have been, every morning I'm on a 10:30 call with.
Well, also, you can text me. I could answer questions by text if you get stuck.
Oh, thank you, Kathy. Yeah. Okay. So every morning at 10:30, I am on a call with the TEMA group, and it is our
I'm gonna head out.
Oh, okay. It's our emergency management group, where we are basically hearing a briefing every morning from Dr. Dart from the Tulsa Health Department, explaining what is going on right now in Tulsa County, and then he does a Q&A. So oftentimes, if you all send me a message with a question, my response is, that's a great question. I will ask Dr. Dart tomorrow morning. And so, so I'm doing that every day. And then most days we're having a noon press conference with the mayor and with Mayor G.T. Bynum and Commissioner Karen Keith, as well as Dr. Dart from the health department. And I, Lori Dexter Wright, and other counselors are on there answering questions on the City of Tulsa Facebook page. Then aside from that, I am sharing resources all day long on Nextdoor, on Twitter, on Facebook, and we'll be sending out some emails as well. Finally, there is we did decide to go ahead and do city council meetings, since the governor gave us the capability to do that, to modify the Open Meetings Act and do that remotely. So tomorrow we will have our 2:30, our 4 o'clock, and our 5:30 city council meetings. There's not anything particularly controversial on those, but I do want to make sure that you all check in on those agendas if you're interested and concerned, and send an email to me at dist4@tulsacouncil.org to let me know if you have any comments that Marissa and I need to share. So going through some of these slides real quick, as many of you know, I have been working for a while to establish the Neighborhood Association Leaders Alliance, or NALA, of D4. We have this one good thing about working from home is that Marissa and I have some more time to be able to devote to things like finding out exactly who is representing every neighborhood. Some of our neighborhoods don't have representation, some of them do. Some neighborhoods have elected representatives, others have self-appointed. We are creating a spreadsheet, and we're going to share that with all of District 4, letting everyone know who says they're representing you. So we hope to have that out soon. Let's go to slide 2. I wanted to make sure you all know that Take Control Initiative they've been gathering telehealth resources for all sorts of different local and statewide and national clinics, where if you have an illness of any sort, you can check in and see a doctor. One of the big concerns we have as we see COVID-19 cases increase is that people who have other illnesses will get squeezed out of the healthcare system. It's something that is causing us a lot of concern. I want to make sure that you all have these resources before you need them. I'm posting them on social media. I wanted to put them in here, and I'm going to be sharing this presentation with you all as well. Slide 3, yes. The Tulsa Health Department website is updated every day, and they are getting the most up-to-date, credible information. Sometimes it takes the CDC a minute to get our numbers from Oklahoma because they are gathering the information from everywhere. So sometimes you'll see a little bit of lag between, you'll see there that we're showing more cases reported at Tulsa Health Department than CDC is showing for Oklahoma. And that's what that is. That's that lag. So your Tulsa Health Department is really the key organization to watch. I feel really confident that this team is doing the absolute dead level best that they can. As many of you have, I'm sure all of you have seen, our resources are limited. It's extremely frustrating. Every morning I hear Dr. Dart and his team biting back the things that they feel like saying about the federal and state government not giving us more help. But we at the local level are on top of it. That's what I can say about that. And we'll have more questions in a little bit. Let's go on to, the City of Tulsa website. We are constantly updating this as well. This is actually a couple of days old from when I made this slide, but we're making sure that everyone understands. We've got a good FAQ on there. Like, people are asking me, is a brewery something that should be closed at this time, so on and so forth. Any questions that you have, they're probably covered under the City of Tulsa FAQ. Next slide. Oh yeah, this is just something I want to keep reminding people that if any of your utilities get cut off, that should not be happening. If they get cut off, we are set up to get them back on right now. We have a moratorium on shutoffs. Some of those are things that the utilities have put in place. Some of that's the City of Tulsa has put that in place, but nobody should be getting any utilities set off right now or shut off right now. If you do, call 211. If that doesn't fix it right away, let me know. We also have a moratorium on evictions. Right now, no eviction cases are being heard in Tulsa courts. We have heard some really disturbing reports of some landlords locking people out for non-payment of their rent. It's illegal. These are not cases that have been prosecuted in court, and we are keeping track of that. If you hear of that happening, again, report it to 211. Let us know. We're keeping track of who these landlords are. We really are working at the City of Tulsa to try to improve everyone's understanding of who's a good landlord and who's a slumlord, and guess who which list those people are going on. I mean, it boggles the mind that some people can be so callous. I know that there are landlords that are fearful about their mortgages. I am afraid of that too. Getting a new tenant right now is near to impossible. And instead of kicking people out, obviously we need people to go to the resources that we have available and to let us know what is going on with them. So moving on to the next slide.
Harold Skip Morgan had a question about filing income taxes. He says he thought that those were deferred until July 15th.
Yes, I believe that is correct. Is that not what we have on here? Yes. Until July 15th. That is correct.
You had that you still had to file by April 15th, but I thought I saw like day before yesterday that had also been pushed to July. Not that I would take advantage of that.
Maybe so. That may have updated since then. Okay, so I'll look back at this and see. This was a great slide that April made, but she made it a few days ago, as I said, as I was compiling these over the weekend. So it's a constantly evolving situation. Skip, you may be right. I'll double check that and we'll update that before we put these slides out. All right. What other? Yes, United Way is working to. They have a fund for businesses that are experiencing losses as well as a fund for individuals. I didn't manage to make a slide for it, but the Lobeck Taylor Family Foundation has also established a fund specifically for food and service workers to receive grants, and they are their foundation is receiving donations. So two really great ways, both United Way, Lobeck Taylor Family Foundation, helping our neighbors who have lost wages and businesses that have lost income at this time. So if anyone asks you where to donate, those are two awesome options. Both of those websites also have the application. If you need assistance as a business or as an individual, you can apply there for one of those grants. What have we got next? Oh yeah. Another disaster relief loans are now approved for all of Oklahoma, and you can go to sba.gov/disaster to apply for those. So there's a lot of different resources to be able to apply for relief. Let's go to the next one. A question I was getting a lot today, what does essential businesses mean? So if you watched Governor Stitt's press conference, you may have felt a little confused this afternoon. I was. We're hoping that he puts out a white paper, a document with some more specific details of what he was saying. But basically tomorrow night at midnight, all non-essential businesses will be closed. Healthcare and grocery stores, pharmacies, and takeout restaurants are still going to be open. If you're wondering what essential businesses means, it's the health, the law enforcement, the food and agriculture, energy, water, sanitation, transportation, public works, communications, IT, government services, critical manufacturing, hazardous materials, chemical, and defense. And if you're not sure if your business or a business falls in that, let us know and we will try to answer that. You could probably find out and at any point call it by calling 211. We have tried to staff up 211. At first people were calling and not getting through. I think that's been better in the last few days, but let me know if that isn't getting better. All right.
We have a question about if churches are included in the closed businesses.
I believe so. I believe churches are considered non-essential businesses. I know a lot of churches have moved to online, but yeah, they're not considered within the essential businesses. What churches decide to do and how this will be enforced, I really can't say at this point, but I will check into that at tomorrow's 10:30 meeting and make sure to get back to everyone about that, because churches, synagogues, all of that, I'm not sure. I know that most have already closed, but certainly all haven't. And I think that what this does, what the governor put forward today, does close any religious organization. But yeah, I need to double check on that.
And I just want to make a note on the health. I think that all like specialty health providers, I think they're all included in non-essential businesses. Speaking from my own personal story, like my dermatologist just called me and told me that they're not seeing patients after tomorrow, so I had to go today.
Yeah, I was wondering about that. Chiropractors and some others might be closed as well. I'll get clarification on that tomorrow as well. Marissa, did we have any other slides before we go to talking about, or to answering some questions and then talking about what other people are doing? Oh yeah, I wanted to remind everyone to fill out the census and to remind other people to fill out the census. Many of us are trapped at home. It's a perfect time to fill this out. It makes a huge difference with regard to funds that the state of Tulsa, the state of Oklahoma and the city of Tulsa receives for different populations. So anytime you can share that information or any of the factual information that I'm giving you, it's a big help to us. It's one of the things that everybody can do. I've found in times of frustration like this, one of the best things that I can do to decrease my anxiety is to help, is to do things. Speaking of decreasing anxiety, I love that you put this slide in there. Thank you so much, Marissa. Managing anxiety related to COVID-19. I think most of you have heard me say before, remember the acronym HALT, never get too hungry, angry, lonely, or tired. So, make sure you're resting and eating well. Express yourself if you're getting frustrated. Lonely, I know, is a little bit tougher right now. My dad and my sister came over and we literally sat on like 10 feet apart in our front yard, in my front yard the other day, just to make sure that we could have that human contact, even though we're not hugging each other or breathing on each other. There are a lot of things that we can do to say that serenity prayer and control the things we can, and try to be calm and model calming behaviors with our children. I've seen people posting online about, hey, what's your favorite meditation app? It's a great time to start building those skills. Not letting fear drive decisions, to resist the pack mentality. I heard a great point from the mayor today is that we have 2 toilet paper factories near Tulsa. We are not in any danger of running out of toilet paper in Tulsa. And so, I think that you all are aware of that, but, make sure to encourage people to not panic and hoard things that they don't need. Remember the big picture. I always, in times like this, think back to our ancestors who have made it through the Black Plague or whatever other major tragedy in history. We overcame feudalism as a species. We can do this. We can make it through this. I posted the other day, your grandparents had to go to war. You're being asked to sit on your couch. Now, I know that sounds like it's trivializing things a little bit. This is really tough. But I absolutely, we believe we can take care of this. I like monitor your alcohol intake. I'm going to add to that, monitor your sugar intake. I think a lot of us have been stress baking. It's hard to stay healthy in a time like this, but moderating those things that can really shift our moods makes a big difference. And then doing the small but important things to care for your mind and body. Again, that HALT, never get too hungry, angry, lonely, or tired. Reach out to other people, and take care of yourself and ask for help if you need it. I think we all need it right now, personally. What else have we got, Marissa?
I think that's it for us.
That's it on those? Okay, well, let's go back to the screen of everyone. Wonderful to see your faces. We've got, let's see, it seemed like we had another question in the chat. What is the procedure for getting tested? This does not seem clear. Joanne, you are right. It is unclear, and part of that is because we don't have enough tests. What we're trying to tell people to do is to call your healthcare provider. If you don't have a healthcare provider, you can call the health department, you could call a hospital, but don't show up anywhere trying to get a test. Call a healthcare provider. They are screening and they will let you know if you can get a test. Right now, the whole nation is limited in how many tests we have. We're working really hard to ramp that up. The state of Oklahoma has been working on other testing options. Joanne, go ahead and unmute yourself. Yes, ma'am.
Just a quick question. Do they plan on having any drive-through testing in Tulsa?
Yeah, we've been working on that, and we actually have it all queued up and ready to go as soon as we have the tests and the reagents. We have the sites, we have the procedures, we have the trained personnel. It's just the test kits that we don't have. And so as soon as I know it's just bonkers that we're not more prepared. I was listening to NPR today, and they were interviewing a fellow who the guy who wrote World War Z, and he was talking about how if this had happened in the 1960s, we'd have backups of all the personal protective equipment, all the test kits and all of that, because we used to stockpile those things. And then we decided as a nation that wasn't cost effective because we wanted to run government like a business. And so here we are. We plan to purchase as needed, and we get to see why that doesn't necessarily work. So that's the situation we're in, and that's why we're working so hard to flatten the curve, because we have to get more test kits and get those hospitals ready. Casey said flour was out of Reese's a little bit a while ago. Yes, and I know some grocery stores are kind of holding things back and putting things out a little bit at a time to deal with the people who come up and buy 12 all at once. So if something's out one day, it might be in the next day. It's a good idea to call in advance. Of the 12 reported cases of COVID-19 in Tulsa. How many are hospitalized? That's been a question that's been asked pretty much every day on our call with Dr. Dart of the health department in the morning. And because of HIPAA, he can't disclose a lot of that information. So I don't have information about specifics of who's been hospitalized, where, and all, and all of that. We do know that because we're not testing enough, there are more people that have it than we know about. And so until you have the virus isolated, you do not have a test. I'm not sure I understand that one.
There was another question about what the penalty is for enforcing the no groups over 10 declaration.
Yeah, that's a great question. And, I saw someone asking during the Tulsa press conference this afternoon, what TPD will be doing about that. I fortunately have a really great relationship with our new police chief, and I'm going to text Chief Franklin about that and find out exactly what they're doing, because I know that sometimes our unsheltered populations are tending to gather. I am hoping that we're not going out and arresting all of the people in the homeless camps. I'm certain that we're not, because he and I have had really good conversations about how one of the worst places for people to be right now is inside the jail. And so we're not arresting people unnecessarily, but what is the penalty? What is it that we're doing? I'm not certain. I know that we're taking this very seriously, so I will be talking to him about that, and I will post some more information. Tomorrow's Wednesday, we've got council meetings. It may be Thursday before I get all of that information out there, but Marissa and I will work really hard to answer those questions for y'all. Marissa, what are the questions? Yeah.
Food trucks, are they the same as drive-through? Are they open or not?
Ooh, good question. I would think that a food truck could be exactly the same as a drive-through, as far as you're just receiving the food through the window or brought out to you in your car. That would be my guess. Yes.
I went to a food truck out in East Tulsa a couple days ago, and they had it set up to where they normally do have tables for people to sit, but they're not allowing people to sit there right now. So people just have to wait in their cars or just stand around waiting for their food.
Yeah, that makes sense. That's what I figured. What other questions do we have?
Lori Phillips, people on a limited diet are having difficulty purchasing food. Oh, I think will limits be set on the number of items people can buy? Yes. Do we have any final decisions about the school year?
Yeah. It's one of the things I had asked for this year, and we'll see if this gets to happen, is for Tulsa City Council and the Tulsa School Board to have a joint meeting. Maybe it'll be easier now that we're doing everything by video. Who knows? But because we are so divided, I don't always know what's going on there. I do know that Joy Hoffmeister and Deborah Gist have said things like, it seems unlikely that we will be able to go back to school for the rest of the year, which is tragic for the seniors who are missing their prom and graduation and all of those last things. I personally am committed to, once it's safe, making sure that those kids get those experiences that they've missed. And I know that our TPSs and Union and others are working really hard to figure out how to do some ongoing education at home. I don't know more specifics than that, but I'll stay as looped into that information as I can and get that out there. Yeah.
We had another question from Joan Krager. Most of the members of Crossroads Clubhouse use Tulsa Transit. What are our public transportation officials doing to disinfect their buses, etc.?
Yeah, Joan, thanks. Ted Reek from Tulsa Transit is on those calls with us every morning at 10:30. I know at first they also didn't have the stockpile, and they were running out of things like hand sanitizers for the bus drivers and cleaning wipes for the buses. They said have enough of those. What we are doing is limiting buses to less than 10 people riding the bus. It's a rough situation to be able, I don't know how much that is affecting our capacity. That's something that I needed to check in with Ted about as well. I know that we're trying to be really careful about that. And I'm sharing information from them as it comes out, but I will ask them again in the 10:30 meeting as well, what impact they see that having, and are people being able to get where they need to go? Do we have enough buses out there to be limiting to 10 people and still getting people where they need to go? It's a great question.
That's all of the questions that I see in the chat.
Great. So I wanted to shift then to talk a little bit about what you all are doing, what you see happening in your neighborhood. So this isn't, we need this, but right now, is there something going on in your neighborhood that is helping people that you want to make sure we know about right now? I know several of you have things going on. Nick, do you want to talk first? Okay, go ahead and unmute your microphone and tell us about what you all are doing.
Can you hear me? Hello? Okay. My name's Nick Simon. I live over at Florence Park. And so what I'm trying to do, and I've kind of stalled for the last couple of days, but I'm about to start pushing it again, is I have a number of FEMA certifications and used to work for the federal government and the military doing decontamination procedures and whatnot. And so what I'm trying to do is put a team together in which we use social media to do donation drives, essentially people to have things that they don't need. And we'll also have a website where people can request things, and then we can go pick it up. And then we can do decontamination procedures, and there's a couple of different ways to do it. I think the safest way is to do like a 72-hour buffer where we collect things. I already have a warehouse set up, and I have like a fully enclosed 30-foot trailer as well as a 17-foot trailer, so we can kind of cruise around on neighborhoods and then pick up these supplies and take them to storage, set them somewhere for 72 hours, and at that point in time, have compiled a list of people that need things, and that way we can take our inventory and then deliver them to people that are in need. So that's kind of my mission. That's what I'm working on right now. That's it.
Yeah, thank you, Nick. That's great. That's great. And good elevator speech there. I know we have had, as this is an ongoing situation, as we're constantly learning about COVID-19, it being a novel virus, we're still learning about it. And I know on the Facebook chat, Skip had mentioned that the virus is off things within 2 or 3 days. With the 2 cruise ships, they were finding that there was still some live virus 17 days after people were evacuated. So we're trying to get a handle on how long it takes to make things really safe. So I wanted to mention that to you, Nick, and to everyone, because it came up in Renaissance neighborhood. People, it's a great time to clean out your garage. I mean, many of us would be doing spring cleaning anyway. People are cleaning out their garages and sharing things with their neighbors. Make sure that you're wiping things down when you give them away and when you receive them. And I know, Nick, with your FEMA training, I know that you all will be on that, and I feel really confident about that. And please, everyone, be reminding your neighbors about that too. It's fantastic that people are sharing things, but we have to continue to be really careful. All right, is there any other neighborhood representative that wants to talk? Joanne, yeah. Joanne Pearson, yes.
We're just we put it out on our email, Lawrence Park South, that we just don't want to forget the people that are still continuing to deliver to the house. And several of us have made up little baskets and just a little note saying thank you for, still delivering to our house, and sanitized a little snack and put it into a Ziploc bag, and some people are putting out Gatorade and things like that. Just a little something, just to let these people who deliver, 24/7 to us, that they're really appreciated.
That's sweet. I love you all. I really do. I appreciate hearing that you're out there helping those folks. I mean, I had 2 different deliveries come in the mail to my house today, and you're right. There are people out there that are working really hard to keep us going. I see Kathy Edwards mentioned, I walked the neighborhood, left cards asking for contact info, made a spreadsheet directory, emailed it so folks had all the contacts, and also set up a text group. We'll be checking in daily. That is fantastic. Kathy, remind me the name of your neighborhood. I want to say you're part of Maple Ridge, but I could be.
I'm Maple Ridge North.
Okay, Maple Ridge North, that's right. Okay, fantastic. I remember most of where everyone lives from knocking doors a couple of years ago, which is amazing, at least with you all. Not everyone. Oh, thank you for putting, if anyone wants Nick Simon's phone number, he put it in the comment, in the chat list as well. We for sharing goods and getting things to people in need. You know, one of the things that I was really hoping that I would be able to do this spring is to really get us out there, knocking all the doors, getting to meet all the neighbors, really compiling those lists to make sure that we can contact everyone. Because as I have been saying to you all, there are vulnerable people in our communities that aren't getting the information from the internet or from the news, we want to make sure that they are connected. I'm going to be talking to my colleagues tomorrow to see if there's a way we could maybe put up some neighborhood signs on the corners for people who aren't answering their doors, or who are afraid to pick things up off their doors, that would share some of the information about where they can go to get help, at least the 211 information. I'll be checking in with 211 about that. So I'll let you all know if I've got a bunch of signs to put out on the corners, then by golly, we will do it. I know I had some other neighborhood reps that wanted to share some of what's going on. Jasmine, yes, ma'am.
Hey, can you hear me?
Yeah.
Okay, cool. Just making sure. So in our neighborhood, we're pretty, I live in Crosby Heights. We're more of a working class neighborhood, and we don't have a lot of people who have access to transportation. We don't have a grocery store super nearby, and also a lot of the people in my neighborhood don't have internet access. And so essentially, I just kickstarted a mutual aid project where I printed out flyers. So far, I passed out 150. I have another 150 to pass out, but just gave them like a Google Voice number that they could text if they needed help, or supplies and things like that, because I also know there's a lot of people who are disabled in the area, and I just don't want them putting themselves at risk. So I kind of have a core group of volunteers who are like healthy young people who are willing to go out and collect supplies and then transport it to people, and we just leave it on their porch. And so it just started on Saturday, and I've had 17 people contact me so far, delivered groceries and other supplies to 10 people. So that's kind of what we're doing. I started a GoFundMe to help support the finances of it, and it's been kicking off pretty well. So yeah, that's kind of what we're doing.
That's fantastic. If you all have it, yeah, right. Yeah, I see you applauding, Joanne. I'm feeling that too. And if you all haven't, I'll take notes from this video. But if you have a plan that you've written up, feel free to send it to Marissa and I. I really, what I want to do is create a way to share information back and forth, so that neighborhoods that want to do something that don't know what to do, like here's what Marissa or what Jasmine in Crosby Heights is doing. Here is what Nick in, oh my gosh, I've just forgotten your neighborhood again, Nick, remind me.
Florence.
Florence Park.
Florence Park, that's right. And Joanne, are you in Florence Park as well?
Florence Park South.
Okay, all right. Yeah, that's why I was confused. Okay, fantastic. I want to be able to share the information back and forth between what you all are doing. So Bob mentioned that of the almost 300 people on their email list in the museum neighborhood, everyone's been contacted with a request that anyone in need should contact the board members. And so far, people are helping one-on-one back and forth. I love hearing that folks are helping. Before we end, and there may be some others that want to chime in, just so you all know, I've only got 45 minutes on this, so just in case it gets cut off, I am. But while we're talking, I'm going to post this video and make sure that everyone can see it. I am going to on Facebook. Marissa is going to be able to house it somewhere, and I am going to be emailing all of you with a poll to find out if we should do this on a regular basis. When I'm happy to check in with you all via Zoom once a week if that's what makes sense to you. So when you see that email, let me know. Did I have anyone from another neighborhood that wanted to weigh in? Marissa, did you see someone? It looks like Xavier.
Yeah, but I'll let Marissa talk first. 'Cause I think
Oh,
she's-
okay. Yeah. Marissa, did you have something?
I had something. We got a little bit of an extension on Zoom for free.
Ooh.
We wanted to keep going for another like 15 minutes. We probably could.
Okay, that's great. Let's do that because I know that there are still probably more questions and concerns that we haven't answered. Hooray! Yay! Okay, Xavier, go for it.
I'll try and be brief. Thank you for the invitation, KG, and everyone else. I am no longer a District 4 resident, but I still have a lot of heart, for the folks there. And in the organization I'm with, Green Country DSA, we've been wanting to build a mutual aid project that kind of had a more strategic intervention. We know there's a lot of people, there's a lot of people trying to do stuff like in neighborhoods, and there's a lot of like charities out there that are trying to help people. So we try to identify like who the folks that might fall through the gaps. And we know that there are utility cutoffs, like moratoriums and eviction moratoriums, but even before this all happened, we had one of the highest eviction rates in the entire nation here in Tulsa. So we identified that as one big major kind of challenge that's going to be down the road is like once this crisis is over, a lot of people are going to have much less income, whatever kind of relief package does come from the federal government or otherwise, and they're not going to be able to pay these bills that are kind of piling up. So we identified that one of the best ways we could try and help is get in touch with people who are facing eviction or utility cutoffs normally or can't keep up with that, be able to provide a relief fund for that. So we put together this project called a Neighborhoods for Equity and Solidarity in Tulsa, NEST. We wanted to come up with a fun acronym. But the kind of idea is we're going to build this relief fund. It's going to launch tomorrow. Raising money with our national organizations network and just locally here to be able to give money for people's utility bills. About $150 is what we're looking like as kind of just no means test, flat, being able to stipend every month. We'd be able to give someone $150 once we had an interview with them. But kind of the larger vision that we want to do, and this is why I was really excited to kind of be on this call and talk to more people here that are working in their neighborhoods, is we want this to be a longer term project. Because like while this is an immediate crisis that we want to help people in right now, we recognize that going forward, there's this economic downturn we're facing. There's all these other things that are just kind of exacerbating on it. And we want to be able to bring neighbors and tenants and all of these people that are facing these kind of issues together and talking to each other, whether it's neighborhood associations, maybe like tenant organizations and stuff like that, be able to kind of put them in contact with other people's resources. And like for the information that like Nick is putting together, when we have people contact us, part of the interview process is also finding out what other needs they may have, what other kind of like situations they have, and be able to connect them to those resources. Obviously, there's stuff like 211 and stuff like that, but we're working with Dream Alliance Tulsa, which is an undocumented led organization. And one of the particular communities we're wanting to reach out to are undocumented people who are not going to be able to necessarily go to a charity or the government and be able to receive that because of the very precarious situation they live in. And we want to be able to, again, find people who would otherwise fall through the cracks. So I'll put my contact information in there, and if you want to help us out at all. And like I said, it'll kind of come out on Wednesday. We're having a call actually immediately after this to kind of get everything together, but hope to be working with you folks more.
Xavier, thank you so much. That's great. And I want to make sure I'm making a note to remind myself to connect you with Becky Gligo with the mayor's office. She has been working on that a whole lot, and she will be very happy to know that another fund is starting. There are a lot of barriers. Also, just speaking of undocumented people and Spanish-speaking Latinx communities in general, Marissa and I have felt really concerned that while we at the city are making sure that we're putting everything out in Spanish and in several other languages, both on video and on links on the city website, that it's one thing to have it available and it's another thing to make sure people get that information. So if everybody could help us in boosting that signal and sending information to people who don't necessarily speak English, if you have any contacts, sending that information along and helping us boost that signal, that would be a really big help on any resources that are available, but especially the ones that are on the city website.
And if I may just chip in real briefly, that's actually, we've reached out to a couple of people to help translate some of our materials. And while Spanish is probably the primary language that a lot of other Tulsans speak, maybe primarily don't speak English, there's also 5,000 people in Tulsa that speak either one form of Chinese, Hmong, or Vietnamese. and don't otherwise speak English fluently. And so that's, I think, another underserved kind of area, which we don't always think about. And, you know, like, again, kind of people that otherwise fall through the cracks that we're trying to, we have a Hmong translator, a Vietnamese translator, and we're actually looking if anyone knows someone that can speak Cantonese or Mandarin, be able to help translate for that. We'd appreciate it.
Fantastic. Yeah, good to keep in mind.
Jasmine, I think had a question as well.
Yeah, Jasmine, go for it.
Yeah, so just along those lines, and we can talk about this later if needed, but I've run into, in passing out my flyers, a lot of people in my neighborhood that speak Spanish, and I ran into someone who was basically expressing a lot of fear for what's going on and for not being able to provide for her family and things like that. And I could understand her, but I don't really speak very well. And so I just didn't know if you had any resources or advice in that area, since y'all have been kind of, I've noticed you've been focusing on it too. So I just kind of was wondering if you had any resources I could use to communicate better with those people who speak Spanish in my neighborhood.
Well, that's a great question. Certainly any, maybe we should do one of these in Spanish as one opportunity, like doing a town hall, a virtual town hall in Spanish. I think that between Marissa, Labim, and I, we could probably pull that off. So that's one thing that I'll put on the list to figure out. And then, does anyone else have any ideas with regard to what we should do in that regard? Because it's a great question, Jasmine. I'd like to eventually, have a plan. Oh, yes, Harold, go ahead.
Jesse, I think his last name is Guardiola.
Yeah.
Right? Okay. I went to a seminar that he had a couple of years ago, and what the police department does, because they do not have a large number of officers fluent in Spanish. So what they do is they do a quick and dirty of like the 20 or 30 most useful phrases and teach the police officers to be able to understand and to speak in those 30 or 40, 30 odd phrases. And they find out that that allows them to get by a large majority of the time. Of course, for them, you know, you're going like, you know, hands against the wall and stuff like that. But knowing a few key phrases is probably the easiest and fastest way to get up to speed.
Sure.
With people, and Google Translate can be very helpful on that.
It just occurred to me that we probably also have 211 flyers in Spanish that we could mail to you. So that if someone's talking to you and they're having some concerns, then you've got something in Spanish right then to hand to them would be really good. And so, yeah, Marissa, let's make sure that we've got that available, and we can, Jasmine, thank you for doing that. We will mail you a packet, and we'll ask if anyone else needs those flyers as well, because I know 211 has translators in, not just in English and Spanish, but pretty much any language someone is speaking in Oklahoma, we've got a translator for on 211. And so we can, if you've got anyone speaking any other language in your neighborhood, let us know and we can get those flyers to you. Yeah, I'm glad we're working these things out together here. Okay, so before we end, does anyone have any other questions or concerns, things you want me to ask the health department tomorrow? Specifically related to disaster prep and your neighborhood, things that you want to do, things that you can be doing. If it's not about this and disaster prep in the neighborhoods right now, just email me and we'll talk about it later. But if you've got other questions or concerns right now, I would love to be able to answer and to help. If not, I think that we are good to wrap up, and Marissa can get to figuring out how to get this video out to everyone who's wanting to watch it. I thank you all so very much for taking the time to be here. Let's see, Bob asked, is that a new question of the 12 identified, how many are hospitalized? And Bob, that's some information because of HIPAA. I don't know how many are hospitalized. I've asked at the health department and can't get that information right now. I do know that there are more people that are infected than we have tested, and so I'm basically operating as if anyone might have it. And while those of us who many people get it and have very minimal symptoms. That's one of the scary things about this virus, is that unlike some viruses where once you're expressing symptoms, that's when you're infectious. It appears that one of the things that COVID-19 does is people who have very little symptoms are sloughing off virus and causing the infection to spread much more quickly. And that's part of why we're seeing this, as opposed to the flu and some others, people who don't seem to be sick, may be sick. So everybody just be really careful out there. Please pay attention to what the health department is saying. Bob's saying numbers are not HIPAA protected. I will mention that to the health department tomorrow and see if I can get some more specific numbers on that. Joanne asked when test kits are going to be headed to Tulsa. It's an everyday question. We are getting more test kits coming in, but they're not coming in the numbers that we want as fast as we want them. So they're going to keep heading our way. Skip mentioned that he heard one unusual symptom is the loss of smell. My husband mentioned that to me as well this morning, because I said something smelled weird. It was not that I couldn't smell it, it just smelled weird. But yeah, keep an eye to that. And I will keep putting information out there every day. As you know, this is an ongoing, evolving situation. Bob, I will see if I can get the numbers on the test kits and get that out on Facebook, on Twitter, on Nextdoor, and I will be sending an email again, not tomorrow, but either Thursday or Friday. We'll be sending out an email from Marissa and myself. Thank you all so much. We'll end it there, and I will see you all again soon. Take care. Be safe.
Bye all.
Wait, we have one more question.
Oh, I'm sorry. Yeah, one more question.
Xavier asked, I think he's not on here, but he asked, is testing being provided for free or will it be billable?
For free. The testing is being provided for free. That's an important question. I'll make sure he gets that answer too.
Free, but it's somebody's paying for it.
Right. Yeah, good point. All right. Thanks, y'all. We'll talk again soon.
Thank you.